Hi, my name is Jasmine Pope, and I want to discuss how to change a PICC line dressing. I don't have the supplies that I need, so I'm going to verbalize exactly what I would do as a nurse. First things first, I would knock on the door, state my name and title, ask the patient their name and date of birth. I will introduce myself, perform hand hygiene, gather the kit for the PICC line dressing and anything else that is needed. I would then go over to the patient's bedside, set everything up. I would place the mask on myself and the patient. I do have gloves on at this time. I would make sure to secure any loose tubing attached to the PICC line, just to make sure it doesn't pull during the cleaning phase. From there, I would then remove the old dressing with the chlorhexidine. It's like an alcohol type base, and that's what's going to lift up the dressing. From there, I would make sure to remove the stat lock that holds the PICC line tubing in place, and I would discard the stat lock. Then from there, I would remove my dirty gloves and I would wash my hands again. Going forward, I would then apply sterile gloves. I have now a sterile field. I would make sure that I'm not cross-contaminating. I would then make sure everything is in place on the sterile field, and I would go to the PICC line insertion site, and I would begin to scrub the site with the alcohol swabs. I would make sure I clean the area that's surrounding the insertion site of the PICC line. And I would basically allow for the antiseptic to dry before continuing. From there, I would then apply a new bio patch and then the skin protectant around the area to then apply the new stat lock device. I would then put the tubing from the PICC line back into the stat lock and clamp it. I would apply a transparent dressing over the stat lock and the insertion site of the PICC line. I would make sure that the end tubing of the PICC line is clamped. I would scrub the hubs and I would replace the lumens, and I would make sure that the end of the IV tubing has new caps. So everything should be replaced, and that is how I would change a PICC line dressing.